morning, dear audience. It's a great honor to have the opportunity to present my PhD topic entitled Current Management of Endometrial Cancer. My name is Madár István. I'm a first-year PhD student and an obstetrician and gynecologist specialist at the Semmelweis University. Our team believes that every endometrial cancer patient's life quality and length can be improved using novel methods. So this is the reason why our mission is to improve the management of endometrial cancer patients by applying up-to-date scientific results. In order to fulfill our mission, we have proposed two major projects. In the first one, started in September this year, we are going to investigate the role of microRNA pattern in the prognosis of endometrial cancer. In the second one, started this month, we will investigate the role of monoclonal antibodies in the management of endometrial cancer. Now, I'd like to invite you to get a short insight in our first project. Endometrial cancer is the most common gynecological cancer, being one of the leading causes of women's cancer-related deaths. Its prognosis is determined by stage and histology, but unfortunately, the current diagnostical methods, the histotype and the tumor grade, are weakly reproducible parameters, which means that indeed there is room for potential better prognostical markers, which would lead to better prognostic stratification. MicroRNAs, on the other hand, are small non-coding RNAs which are validated prognostic biomarkers in several other cancer types, and they can contribute to promotion or inhibition of endometrial cancer. After presenting the two cornerstones of our first project, I would like to emphasize our aim, which is to provide a better survival rate and optimize the treatment through better patient stratification with microRNAs as prognostic markers. So our clinical question is whether different microRNAs could be used as prognostic markers for endometrial cancer survival. And we are going to check the microRNA fold change in the available studies at endometrial cancer patients. And in the end, we will assess the overall survival and the recurrence-free survival. We hypothesize that different microRNAs show different expression levels in recurrent and non-recurrent endometrial cancer patients. We have conducted our systematic search in the three major databases with the following search key, obtaining more than 8,000 hits. After removing the duplicates, we have more than 7,700 articles available. We were a little bit stuck with the statistical part, but actually our Prosper is already started and the statistical part is right now completed, so we have green light for the future. Now, let's move forward to our second project, in which we are going to investigate the role of monoclonal antibodies in the management of endometrial cancer. As I've already highlighted, the endometrial cancer is the most common gynecological cancer, and unfortunately, the incidence and the mortality rate is rising worldwide, especially in the developed countries. Almost 20% of patients will have recurrent disease. Now, what are we supposed to do in case of recurrent disease? We either obtain for local surgical radical therapy, or we proceed with systematic therapy. This can mean chemotherapy, radiotherapy, or hormone therapy, or therapy with monoclonal antibodies. Monoclonal antibodies are produced by a single clone of cells or cell lines, and they show affinity for the same epitope on a specific antigen, including antigens on the surface of endometrial cancer cells. In the treatment of endometrial cancer, we have four major groups of monoclonal antibodies, which are going to be investigated in our study. After presenting the therapy possibilities, we have asked whether monoclonal antibodies offer better survival. In order to answer this question, we will take a look on women with recurrent or advanced stage endometrial cancer, and we will see whether the monoclonal antibodies therapy and their combinations or the conventional therapy offered better overall survival. Our hypothesis is that applying monoclonal antibodies will offer better survival rate. Approaching the end of my presentation, I would like to summarize once again our aims. We will intend to submit our first project in May next year. The second project is going to be hopefully submitted in August next year. Reaching the end of my presentation, I would like to quote from the king of golf, Arnold Palmer: "Always make a total effort, even when the odds are against you." Thank you very much for your attention.
Congratulations again. My name is Tamás Fazekas, and regarding your first project, I would like to ask that, regarding your second project, have you thought about performing a network meta-analysis and try to compare the different antibodies with each other through a common comparator, or have you checked this opportunity during your preliminary search and statistical consultations?
We think that doing a network meta would make really sense in our second project.
Mm-hmm. Okay, thank you very much.
I mean, these are great projects, and hopefully, I mean, this will advance actually the science of, I mean, making science to healthcare. So in your second project, do we know the genetic background of the patients actually in general, or are there studies when they have the genetic background? Because if you use these monoclonal antibodies, I mean, that's important, then you target something. So therefore, I mean, in order to target, I mean, a certain pathway, I mean, you need to know that that is actually malfunctioning, overexpressed something, or an inhibitory pathway doesn't function. So do you know about this, or are there studies in the literature on this?
Actually, most of these studies, which include monoclonal antibodies, are with known genetical background. The newest, the dostarlimab, for example, are dealing with mismatch repair deficient patients.
Well, the other question is about this microRNA story, which is quite exciting, but I always try to ask this kind of question. So, are these consequences or causes? You don't need to know actually for just using them as a biomarker, but that would be very good to have a clue behind this, that what they really do.
Yes, it would be really a food for thought, if we know.